else?
Well, it probably can't, and it's possibly why it goes into panic. But
and that directly affects the immune system, does it?
well, again, this is a possibility because some statistics have shown that people with autoimmune diseases and allergies may have a lower incidence of cancer. So you could actually see that autoimmune diseases or allergies could be a body over-responding to a cancerous environment.
Hang on. So if you've got autoimmune disease, you're saying you've got less chance of getting cancer?
Statistically. Yeah, it's not total protection. I mean, look at insurance. That's not total protection. There's usually something that doesn't quite cover everything. But it could be. It's like the analogy is sickle cell anemia in west coast of Africa, which is a very high area of malaria. Some people have actually, through their bodies genetically, some people have managed to change the normal dish shape of their red blood cells into a sickle shape. So when the mosquitoes inject their nozzle into the bloodstream to squirt out the protozoa that leads to malaria, because their sickle cell, when it draws up the blood first before it injects it back in, it can't, because the sickle cells actually physically obstruct its nozzle, therefore protecting those particular people from malaria, which is a killer.
Yes.
But the problem is they get sickle cell anemia, which has its own symptoms, and also it tends to shorten their life. However, if you have the choice of having sickle cell anemia or getting malaria, you choose sickle cell anemia. And that's what the body has actually done genetically. And so parents then pass that trait on to their children as a protection method. And that's just one of many. There's a whole, and we don't have time here, there's a whole list of conditions.
So the body's trying to help us out, really.
It's doing the best, it's reacting the best way it can with what it's got against the more severe condition. So it could be...
It's pretty smart thinking, isn't it? No else, or programming, or however it works.
Well, it is. I mean, the immune system has and as I said before, has its own intelligence, which it actually learns to protect us through experiencing infections, which is why it's important that it does, as long as it's moderated correctly and properly. So it could be that, as I say, allergies and autoimmune conditions may be a response to our toxic environment.
Yes.
Now, in the sort of general medical profession, there's another theory. They're actually saying that since the 1950s, our lives became more sanitized. We used more cleaning products. We lived in a more sterile environment. We kept the bacterial levels down. And therefore, our immune systems had less to do and then became, if you like, unemployed youths going around the town smashing up phone boxes because they got bored. And so our immune systems, well, that's what they say. Analogy. That's the theory. But I say, well, what about the Eskimos? Eskimos, or Inuit people. The Inuit people lived in sterile conditions, yet they had no allergies or autoimmune problems. They still came into contact. They had to eat fish and seal, so they could. There's no reason why they could produce allergies or autoimmune problems. So I don't think the sterile argument is actually the right direction. I think it's the agents that produce the sterile environment is the cause. All the chemicals that are used in all the bleaches and the soaps, etc., creating a chemical toxic environment that sets the body into a reaction. Now, a person with an immune deficiency potentially could go into a cancerous situation. A person with an immune response or reaction could potentially go into an allergic or autoimmune condition. Yeah. And then, of course, there's people in the middle who don't get either.
So what can people do who've got a problem with the immune system, autoimmune disease?
What can we do? I think it's very difficult because without the chemicals, we wouldn't be here in the studio talking, reaching whoever is watching us out there.
Yes. So
we can't condemn it, but we do have to find a way of containing and protecting ourselves. Because, in a sense, if you actually look at the history, for instance, cancer, autoimmune diseases and allergies, which is quite modern in the last 50 years in the terms of huge numbers and excess and growing numbers, it seems clear that our environment, our toxic chemical environment, is the main cause. So it doesn't make sense to be continually looking for new cures for cancer when all we have to do is reduce the cause. Surely, I mean, that's the intelligent way to go. Because by looking for new cures, you're still producing all the toxic elements that create the problem in the first place. So we actually have to look at reorganizing society. For me, I know it's a huge, in terms of a fundamental solution, it's a huge one, but I think it's the realistic one. We actually have to look at a way of reorganizing society to protect ourselves better from all the chemical agents. At the moment, we just allow them to run freely amongst us, wild and uncontrolled. Certain killer chemicals have been withdrawn.
So when you say reorganise society, you mean stricter regulations on when you're allowed to use these chemicals?
I think we need to cut them down. We need to start cutting them down. And I think we'll see rates...
cleaning materials and...
Yeah. And I think we'll see rates of cancers and autoimmune diseases drop. And I think once we see that, we think, yes, this is worth it.
Yeah.
This is what we have to do. I think this is, at this particular age, it's a turning point. I think we have to learn this. Because at the present growth of these conditions, now unchecked and no real treatments really on the horizon. Of course, the most successful one is surgery, of course, but the other treatments are still struggling to keep up with it all. We do have to look at different ways, different directions to travel to bring this whole condition down, and that's how I see. That's what we have to do.
And is there a role for Western medicine in this?
Yeah, I think there's a role of Western medicine. As I said, in China, they use Western chemotherapy and radiotherapy alongside traditional herbal therapy, so you can actually reduce the amount of radiotherapy and the amount of chemotherapy that you give patients, and therefore you don't damage them to the same extent. So you'd still, the condition is, even when we start withdrawing from chemicals, if that's going to happen, it'll be a slow process. You can't just take society apart very quickly. You have to do it very mindfully and very slowly and very carefully. And of course, those treatments will still need to develop and perfect and get better, because there'll still be many people who will need the help from those medicines. And we still need to, in terms of autoimmune and allergies, my particular interest, I still need to develop it. Because there's still the question, if autoimmune diseases and allergies is possibly, and I say it's only theoretical, might be wrong, but if it is a protective against the rise of something like cancer, is it right then to actually calm them down? Or how do you calm them down that the person doesn't lose that protectiveness? Or what makes the person more reactive than a person who's not reactive, and doesn't have any immune problem, any immune diseases or allergies, neither do they go on to get cancer. So there's a lot of questions to be asked, but we need to ask them. We need to pursue them.
See, the good thing is that we're getting more and more information from more and more different sides.
Yeah.
And you mentioned earlier that Western medicine seems to be much more open to working with Chinese medicine and vice versa.
Yeah.
So it becomes more of a genuine teamwork, as opposed to one thing being right and one thing being wrong. And as you know, as patients, we all have access now with the internet to a fantastic amount of information.
Yeah.
So in one way, if you're willing to put a bit of research into your own situation, there's a lot of things you can find out, and maybe you can find a way to navigate a course to find a healing that works for yourself. Yeah,
absolutely. Well, I would recommend people to check a website. Dr. Simoncini is an Italian doctor. That's Simon, S-I-M-O-N, Cini, C-I-N-I. And you can actually look at cancer bicarbonate soda, which sounds a bit strange.
What's that, cancer?
Bicarbonate soda. Right. He's actually been working for some years now, and he's actually found that a lot of tumours are actually fungi, particularly Candida albicans.
Right.
And he actually uses successfully in his own oncology clinics. He's an oncologist.
Right.
He's a cancer doctor. He's been using bicarbonate soda, which is a very powerful antifungal without the nasty side effects, to actually shrink tumours.
Right.
And it's a very interesting website. You can actually see him give a lecture and actually show film evidence of his work. So I would recommend people to check that site.
Okay.
Yeah.
Ken, thanks very much for coming in. It's been fascinating.
Okay.
And we'll invite you back again soon, I think, to talk about this all in even more detail.
Okay.
And thank you for watching Ken Lloyd and Conscious TV. We'll see you again soon. Goodbye.